All right, so today we're going to start talking about the nervous system and neuro, okay? And it's responsible for controlling and integrating a lot of our body's activities. A fun cartoon, okay? So when we talk about the central nervous system, we talk about the nervous system. Part of the nervous system is the CNS, the central nervous system. And it is the brain, the spinal cord, and cranial nerves 1 and 2. That's a typo. It should be cranial nerves 1 and 2. And then the PNS are cranial nerves 3 through 12, the spinal nerves, and then the peripheral components of the ANS, or the autonomic nervous system. When we talk about the brain and the spinal cord in the central nervous system, okay, the first thing we're going to discuss is the cerebrum. The cerebrum does have right and left hemispheres, and it is responsible for sensory and motor activity on the opposite side. So the right hemisphere controls the left side. The left hemisphere controls the right side. It is also responsible for governing thoughts and learning. It consists of the frontal part, which is responsible for memory, the parietal, which is spatial orientation and analysis of sensory information, the temporal, which is auditory, and the occipital, which is visual. So along with the cerebrum, the cerebral cortex consists of the gray matter, which is the conscious activities of the cerebrum, and then the basal ganglia, which is the white matter and the fine motor movements. When we talk about the brain and the spinal cord, and this should just be an A&P review. The diencephalon, it contains the thalamus and the hypothalamus, and you can see that they are located they're central here in the brain. They're just above the spinal cord and the brainstem, okay? The thalamus relays all the sensory impulses. It is part of the RAS system, or the reticular activating system, and it is responsible for level of consciousness and arousal. It also contains the thalamic pain gate, and we've talked about a pain gate theory in the past, okay? Thalamic pain is a severe and treatment-resistant type of central pain that may develop after a thalamic stroke. So we know that lesions within the regions of the thalamus carry a really high risk to develop pain. Okay, it's impossible to predict, but that's what they're talking about when I have thalamic pain gate. When we talk about the hypothalamus, it regulates the autonomic responses of both the sympathetic and the parasympathetic systems. It produces hormones. It regulates the stress response. It regulates sleep and appetite, temperature, fluid balance, and emotion. Okay. The brainstem, which consists of the medulla, the pons, and the midbrain, okay, is responsible for coordination, so motor coordination of the arms and the legs. It regulates breathing. It contains the afferent and the efferent tracts. Okay, and we're going to talk a little bit more about those, especially when we begin to talk about our spinal cord injuries. Okay, so afferent neurons with the A-F-F-E-R-E-N-T, are sensory neurons that carry impulses from sensory stimuli towards the central nervous system. So they're bringing the information in to the central nervous system and to the brain, okay? The efferent, so again, here's an afferent. It's bringing information from the skin, the body, into the brain. Efferent, exit is one way to remember that, okay? E for exit, it is exiting. It is, they're the motor neurons that carry the impulses away from the central nervous system and towards the muscles to cause the movement. So an example would be if somebody was touching something hot, the afferent nerve would get the message up to the brain, and then it would be the efferent nerve that would actually tell that person to pull that hand away from that hot surface. Okay? So understanding that is helpful. It also, the brainstem, the medulla pons and midbrain controls the heart rate, the respirations. It controls the blood vessel diameter. So we're talking about vasoconstriction and vasodilation, sneezing, swallowing, vomiting, and coughing. So there's a lot of information that the brainstem, medulla pons, and midbrain control. The cerebellum, that is responsible for the smooth muscle movement. It also coordinates posture, equilibrium, and muscle tone. Okay. So if the patient has a stroke, let's say in the cerebellum, because that is part responsible for posture, equilibrium, and muscle tone, the patient would be more at risk for falls because of where that stroke occurred. If the stroke was, let's say, in the brainstem, medulla pons, midbrain, that regulates breathing. So you would anticipate that this patient is going to have some problems with their breathing pattern, maybe too slow, maybe not at all, etc. So understanding what each part is going to help you to know what you would see in your patients when they have problems in that specific area. The left hemisphere of the brain is responsible for right hand and right-sided movement. It is responsible for spoken language, number skills, which obviously I do not have that, okay? It is responsible for written language, for reasoning, and for scientific functions. People that are left-brained are very good at puzzles. Now, those of us, or those who are right hemisphere, the right hemisphere controls the left hand and the left side of the body. They are also very creative. They are artistic. They are often involved in music and art, and they have a lot of insight along with spatial orientation. So depending on you, and each of you can probably think about, okay, am I a right brain or a left brain? Okay. Now, some people could be more of right brain versus left brain, but a lot of people are some of each. Okay. That's not unusual to have some of the components of the right dominant, but yet they still have a lot of the left side. Okay. For myself personally, I probably am a little bit creative, but not a ton. I have some insight, can't play music worth a darn. Artistic functions, nah, not so much. Spatial orientation, no. Spoken language, yep. No number skills, none. I'm pretty good at the written language and reasoning, and I'm very good at puzzles, but I'm not that swell at scientific reasoning. So think about yourself, or think about somebody that you know and where they're at. Are they right brain or are they left brained? Okay. So when we talk about the brain and the spinal cord is part of the central nervous system, and it is what produces the involuntary responses to stimuli. Okay. It carries sensory information to and motor information from the brain via the afferent going to and the efferent exiting from the brain. Okay. Spinal cord is composed from C1 to L2. It is protected by the meninges, by cerebral spinal fluid or CSF, and adipose tissue. So it is responsible for the sensory pathways, the ascending tract or the afferent nerve fibers, and then the motor pathway from the CNS, which is the descending tract or the exiting or efferent nerve fibers. Okay. The spinal cord is actually continuous with the brainstem. It exits from the cranial cavity through the foramen magnum. Okay, and this right here is a cross section, okay, of the spinal cord, and it reveals the gray matter, this little area right here. This is the gray matter, and that is centrally located kind of in the shape of an H, as you can see right there. That's the gray matter, okay. The gray matter contains the bodies of the voluntary motor neurons, as well as the cell bodies of associated neurons, so the interneurons. Surrounding that is the white matter, okay. The white matter contains the axons of the ascending sensory and descending motor fibers. And then the myelin surrounding those fibers gives them, that's what gives it its white appearance, okay? When we talk about the spinal column, so here's the body of the vertebra. Okay, right here's the body of the vertebra, and then this is the spinal cord running through it, right here. Again, the spinal cord has a very specific place where it is within that vertebrae to help protect that spinal cord, to protect those spinal nerves. I'm sure you guys remember all of that from A&P, right? Spinal tap, or a lumbar puncture, is between the third and fourth lumbar vertebrae, okay? And the reason they do that there is because the subarachnoid space is the largest in that area of the spinal column. So that's the spot where they're going to attempt to obtain a lumbar puncture. You understand that it's a circle, and it's supplied by the carotids and the vertebral arteries. So when we have a patient who has a maybe a blockage in the carotids, it's going to impair circulation through that specific area. However, because it is a circle, okay, the brain is still going to get the nutrients, the sugar that it needs, because it's a circle of Willis. So our body is very smart how it takes care of us. Next, talking about the neurotransmitters, okay? So the nervous system is made up of two types of cells, neurons and glial cells. Neurons are the primary functional unit of the nervous system, okay? They come in lots of shapes and sizes. They have the ability to generate a nerve impulse, okay? They can transmit an impulse, or they can have the ability to influence other neurons or muscle cells or glandular cells. So a typical neuron here, okay, has a cell body, multiple dendrites, and an axon. So here's our axon, okay, and here's our dendrite, and here's the nucleus, and then here is the synapse, okay. Covering that area is the myelin sheath, and that's to protect it, okay. So again, carries impulses, influences other ones, and transmit impulses is what the neurons are responsible for. In addition to that, we also have neurotransmitters, and these are what is going to help send the signals across the neurons. Acetylcholine, or ACH, norepi, dopamine, serotonin, amino acids, and polypeptides are all of the neurotransmitters. And when we talked about depression, some of the medications we give affect the dopamine transport or the serotonin transport, etc. So that what they're doing is they're affecting those neurotransmitters and the ability then of the talking across these synapses. That's what the neurotransmitters are responsible for. There's not a picture of that, I apologize, okay? All the coracoid plexus is a network of blood vessels and cells in the ventricles, okay? And there's capillaries and special cells that are found in the ventricles that make up this. And what it does is it produces the cerebrospinal fluid, and it helps provide the barrier that protects the brain from other CNS tissue from toxins. So it's going to help with regulating what's going to cross that blood-brain barrier and what's not. The coracoid plexus is that blood-brain barrier. Cerebral circulation, and we talked a little bit about the circle of Willis already, okay? So one important thing about the brain is it doesn't store nutrients. So it doesn't store glucose. It doesn't store any nutrients. It has a very high metabolic demand. It requires high blood flow, and the brain's blood pathways flow against gravity, which makes sense, right? Gravity's down, your brain is up, so everything flows against gravity. So what does that mean? That means that we have to have adequate cardiac output in order to get adequate blood flow to the brain. And we know that the brain has a very low tolerance to blood flow changes. So if that cardiac output drops, you're going to see some effect. And what we a lot of times see in our patients is they'll have some dizziness, or they'll get sleepy, or they'll become restless. And that's because of a decrease in the blood flow to the brain, okay? The cerebral circulation does lack collateral circulation. So because of that, there is irreversible blood damage or tissue damage when the blood is occluded for even short periods of time, because it doesn't have collateral circulation. When we looked at the heart, there was a lot of collateral circulation. That is not true for the brain. We don't have that collateral circulation. We have the circle of Willis, which is great, but we don't have that collateral circulation. So if there is a decrease in blood supply, even for a short period of time, we can have tissue damage, tissue death, ischemia, necrosis, okay? So the structures and functions of the nervous system. When we look at what is going on, we talked about the blood supply to the brain, and we talked about that the blood supply comes from the internal carotids and the vertebral arteries. So in this picture here is the internal carotid artery, okay, running right here. The internal carotid artery is going to provide blood to the anterior and the middle portions of the cerebrum. Now the vertebral artery, which is located right here, running through the spinal column, running through the vertebrae there, the vertebral arteries join to form the basilar artery, okay, and that is going to supply blood flow to the brainstem, the cerebellum, and the posterior cerebrum. And then the circle of Willis, again, so if there's an issue, there's an occlusion in one of these arteries, because there is a circle of Willis, the brain will still get the blood supply, okay? Flaccid. They will get muscle atrophy, and they will have absent or decreased reflexes. So one of the things that we know can cause damage to both upper and lower motor neurons would be herniation of the vertebral discs. So it could affect both and cause a lot of different symptoms, okay? Trauma, infection, toxins, okay? When we talk about some of the disorders like ALS and multiple sclerosis, they affect both upper and lower motor neurons. So understanding what each of them, what kind of symptoms you would see in your patient if it's an upper versus lower motor neuron injury, okay? Next is the cranial nerves, and I know you guys covered this in A&P, okay? So the major functions of the cranial nerves are common sensations, voluntary control of the muscles, and autonomic functions in the head, and the sense of vision, hearing, smell, and taste. Now, when we talk about cranial nerves, they have motor, sensory, or both functions. Okay, so motor, sensory, or both. And there are 12 cranial nerves, and yes, you're going to need to know them for this course. If you have a way to know them from A&P, that's all great. Okay, otherwise I do have a few tips here for you to remember or to review those. Okay, remember that cranial nerves, unlike the spinal nerves, okay, so spinal nerves have afferent and efferent motor fibers. Okay, the cranial nerves have motor, sensory, or both functions. So here are those cranial nerves, those 12 cranial nerves. And I remembered them when I went into college a long time ago in nursing. I remembered them by the mnemonic: on old Olympus towering tops, a Finn and German vexed some hops. So on, olfactory; old, optic. Okay, so olfactory is obviously the sense of smell, so it's a sensory. Okay, on, old, so optic is cranial nerve number 2. It is sensory, it's responsible for vision. Number 3 is the ocular motor. And here is our ocular motor here, and it's showing where they come off of that circle of Willis. Okay, here is our ocular motor, and it is responsible for Perla. It is a motor neuron, motor cranial nerve. Okay, the trochlear, so on old Olympus towering, trochlear is cranial nerve number 4. Okay, and that's this one right here, cranial nerve number 4, and it is the muscles that move the eye. Next is trigeminal. Cranial nerve number 5 is trigeminal. And the trigeminal is called trigeminal because it branches into 3 after it comes off. And the trigeminal is a mixed, so it has both motor and sensory functions. And the very top portion of the trigeminal nerve innervates the forehead. The middle portion is the cheek and the jaw. And then the very bottom part is the jaw and then part of the neck. So that's the trigeminal nerve. And when we talk about trigeminal neuralgia, you know which part of the cranial nerve is being affected by which symptom they're displaying. So that's on old Olympus towering tops. Next is which is cranial nerve number 6. It's the abducens. Okay, the abducens are motor, and it's muscles that move the eye. Okay, Fin, F, is facial, and that's cranial nerve number 7. Okay, and cranial nerve number 7 is a mixed. It is responsible for facial expression and facial muscle movement. Next is cranial nerve number 7. Cranial nerve number 7 is the facial, so that's fin. And the next is a fin and, which is actually, excuse me, and stands for the auditory or the vestibular cochlear. Okay, so auditory or vestibular cochlear right here, which is a sensory cranial nerve. It's responsible for hearing and equilibrium. A fin and German. So German is cranial nerve. Where is it at? Here we are, right here. It's the glossopharyngeal, and it is responsible for the taste and sensation in the pharynx and the tongue. And it is a mixed cranial nerve. A fin and German. Vexed, okay, is how I learned it. Vexed is cranial nerve number 10. It is the vagus nerve. Okay. The vagus nerve is a mixed nerve, and it's responsible for the muscles of the pharynx, the larynx, and the soft palate. Vexed, sum, S is sum, and that is the spinal accessory. right here. And spinal accessory is responsible for the shoulder shrug, okay? And that is a motor cranial nerve. And last but not least is the hypoglossal, or cranial nerve number 12, right here. And it is responsible for the movement of the tongue back and forth. So that's how I learned it. There are many other variations out there, okay? For your neuro exam, for your neuro tests, I know that's what you're thinking. Do you need to know these? Yes, you need to know these. You need to know what their names are. You need to know what number they are. And you need to know, are they motor, sensory, or both? You also need to know, how do you test each of these, okay? Again, looking at that, here's the spinal cord coming up here. Where do each of these come off? Okay, so they each come off in a specialized spot. Here's the vagus, number 10. Okay, here's the accessory, number 11. Here's the vestibular cochlear, right here. And the vestibular cochlear is number 8. Here's your trigeminal, number 5. Okay. These are, they've divided those up. So here's the ocular motor, here's the olfactory, here's the optic, here's the trochlear, the abducens, the facial, the glossopharyngeal, and the hypoglossal. Okay. So again, another picture to help you remember where they are. It would be really nice if it went in order up and down, but it does not, as far as memorizing those cranial nerves and what numbers they are, okay? Another picture to help you understand. Oculomotor is the perla, the trochlear is the muscles that move the eye, trigeminal, abducens, etc. We just went through all of these, okay? Here is another table, and what I like about this table here is it tells you them in order. It gives you a picture, so it helps you understand what do they do. It also tells you, are they sensory, motor, or both. It lets you know what is the major function of that cranial nerve. So what is it responsible for? And then one of the best parts of this is, how do you assess if that cranial nerve is intact or not? And so I would encourage you to become familiar with all 4 of these columns, okay? Again, I would use a mnemonic to memorize. It's the easiest way. If we were to be in class, I would tell you to do, we would be doing cranial nerve assessments on each other, okay? I would have you bring in a little baggie with cranial nerve things that we could test. So how would you test olfactory? The sense of smell, okay? Again, close their eyes and put something would be a familiar scent like a coffee under that nose and see if they can smell it or not. As far as cranial nerve number 2, the optic, this is when the patient's going to read from a card or a newspaper, one eye at a time, okay? They're going to cover one eye, they're going to focus on your nose, and they're going to identify the number of fingers you're holding up in each of the 4 visual quadrants. So that's the optic. Again, I would suggest you guys do this on somebody else. Do it on somebody in your household, do it on a friend or a family member, okay? Cranial nerve number 3 is the ocular motor. This is perla, so we're going to check those pupillary responses with a bright light in a darkened room, okay? You're going to have, for accommodation, as far as the perla goes, you want to move your finger towards the patient's nose, and the pupils should constrict and converge, okay? You can have the patient look up and down, lateral and diagonal, and that's testing the ocular motor or cranial nerve number 3. The trochlear, which is motor, okay, this is the patient can turn their eyes downward and laterally. So you want to do is have the patient look down and in, like cross-eyed almost, okay? Cranial nerve number 5 is the trigeminal. It is responsible for chewing, facial mouth sensation, okay? It is a both as far as the classification goes. And usually when we test this, we have the patient close their eyes and we would touch a cotton ball lightly to each of the 3 areas where the trigeminal nerve innervates on their face and see if they can feel it. The abducens This is putting the eyes out laterally, so we're going to have them move their eyes from side to side. The facial nerve, okay, again, it's a both sensory and motor. And we're going to have that patient smile, raise up their eyebrows, keep their eyes and lips closed while you try to open them. You can, with the facial nerve, because it is responsible for some of the taste, you can have them identify whether you put salt or sugar on their tongue, okay? The acoustic or the vestibular cochlear, which is cranial nerve number 8, is sensory, is responsible for hearing, okay? You could use a tuning fork, which we would use in class if we were there, or it's very easy to actually just rub your thumb and index finger together next to their ear and see if they can hear that or not with their eyes closed, okay? Or you could whisper. That would be fine also. Cranial nerve number 9 is the glossopharyngeal, and it's both motor and sensory. It is responsible for the gag reflex. So you could touch the back of their throat with a sterile tongue depressor or a cotton-tipped applicator and have that patient swallow for you. The vagus is number 10, and it's both motor and sensory, okay? We're going to, again, assess the gag and swallow reflex, and we can have them speak and assess their vocal quality. Spinal nerve number 11 is the spinal accessory, and it's motor, and we're just going to have the patient shrug their shoulders and turn their head from side to side. Number 12 is the hypoglossal. It is motor. It is responsible for the tongue movement, so you can have the patient stick out their tongue and move it from cheek to cheek, and then you can listen and assess how are they articulating their words. So that's some of the things that you're going to need to become familiar with when we talk about the cranial nerves and what you would expect, because you will see these on the exam, okay? Which is Mary, so it's motor is the spinal, and money, which is the last one, and that is the hypoglossal or cranial nerve number 12. So you can use a mnemonic like this, and there are lots of other mnemonics out there. Some of them are filthy. Yes, I don't care how you remember them. You don't have to tell me, okay? But use something to help you remember. And then also something like this. And there are other ones out there also. But to know, are these sensory, motor, or both? So some say marry money, but my brother says bad business, marry money. There is one more thing out there that I would like everybody to watch. And what you do is you use this, you draw out your cranial nerves in the form of a face, okay? So this is cranial nerve number 1. It's the nose of our face, okay? Cranial nerve number 2. This is number 7.